excited to be here. I'm Anthony Mazzarelli.
My name's Steve Treziak.
And so we're going to do something a little different because Haney gave us the license to do it, which is I'm going to essentially interview Steve during this process and ask him some questions, which is fun for me because typically we talk about these topics, the science of service, separately. We don't often do things together. And when we do it together, I don't normally get to be the one to answer questions, but I'm excited to do so. So I want to start with this. Steve, is there overlap between the science of medicine and the art of medicine?
If you think of the two as separate and distinct, we're probably missing really important signals in the data. So specifically, what we did in our work together is that we looked at things that are typically confined to the domain of the humanities and typically viewed through an emotional, sentimental lens or through a moral, ethical lens. And our approach has been to put these things under the scrutiny of science and to examine them through the lens of science. And when you are rigorous about looking for the science in the art of medicine, you'll find that the science in the art of medicine is strong.
Now, when we talk about that science, what usually, or at least the first thing that I know we've talked about in other things that we've done with Haney before, we've talked about the impact of compassion on patients. As quick as possible, what's the synopsis of that impact?
So what we found in going through the scientific evidence, we tested a hypothesis, really, that compassion matters for patients, for patient care, and for those who care for patients. And after going through 1,000 scientific abstracts and over 250 original science research papers, what we found is that compassion matters, not just in meaningful ways, but also in measurable ways.
So let's talk about that third one, right? So impact on patients, on the way we provide care, but on the caregivers themselves. So is there any evidence, or what's the evidence about going beyond not just how we interact with patients? What about how we interact with each other, how we interact with strangers, how everybody interacts with the world, not just caregivers and patients?
Sure, and that's really how our new body of work came about, right? So what we received after telling this story and laying out the evidence that compassion can be a powerful, beneficial therapy for the giver too, in the domain of healthcare. We got messages from all over the country that people would test the compassion hypothesis for themselves and care more, not less, lean in rather than pulling back and detaching. And they shared with us the messages is that is what helped the fog of burnout lift for them. So they had the same experience that I did, actually, as we were curating all this evidence. And after receiving all these messages that people were having the same experience with leaning in to relationships, that really led us to think that it can't just be true for people who wake up in the morning and put on scrubs and go to work in a hospital. Is it possible that there is a common thread, or perhaps even a universal? And so what the current body of work actually shows is that serving others is the best medicine for yourself, for everyone, everywhere, and not just for healthcare workers.
So what was interesting to me is, okay, it wasn't that big of a leap to talk about compassion and take away the suffering of others that we do in healthcare, to now thinking about just serving others and being kind to others as having a similar impact. But there was another question, which is, does it mean this is a powerful tool we can all use and it's something that if we just increase more, everyone's better off? Or is it actually addressing a problem that there is a lack of people serving others, a lack of this kind of commitment to connection?
Sure. The evidence does support that we are in a compassion crisis or a connection crisis, that we're on the wrong trajectory, and we actually have been for some time. So the greatest generation, the people who were born during the Depression and fought in World War II, that generation was characterized by many things, but chiefly among them was service and sacrifice. And then in the civil rights movement, of course, that was those in the civil rights movement were focused on something bigger than themselves. And for the hippies, it was peace, love, and understanding. And what the history actually shows us is that sometime during the 1970s, things took a decisive turn inward. And research from the University of Michigan, a meta-analysis, has shown us that over the past 2 decades, empathy has been declining among college-age students. And the speed of that decline has been accelerating over time, to the point where now, in a recent Pew Research study, fully 1/3 of Americans endorsed that they don't consider compassion for others to be among their core values that describes them well.
Well, and you think about, okay, so there's this culture of meanness, and we're saying, hey, the cure for this is to focus on others, connect with others, serve others. And we could go on forever about you're going to live longer, you're going to be healthier, you're going to be less depressed, you're going to have more energy, you're going to sleep better, all kinds of things will flow to you, both personal and professional. But if we were to believe that, and we know the data is there, and we could go do a whole nother one that's just on that data, but what are the mechanisms? There has to be a mechanism or ways in which all these benefits flow to the person who's serving others.
Sure. One thing that I do want to communicate is that what we're talking about here, it's not what we think or believe, it's not our opinion, but it's just what we found in going through all the scientific evidence. And of course, mechanisms are important because we're not talking about magic tricks here. And so anytime we're talking about a scientific pursuit, we have to think about the mechanisms. So just real quickly, when you serve others and you're focused not on yourself and serving yourself, but serving other people, research supports, and this is neuroscience research using imaging modality called functional MRI, where we can see what part of the brain is being activated at any given moment in time. Serving others has a direct activation of the reward center in the brain associated with positive affect, positive emotions, feelings of affiliation. It's part of the reason why it feels good to help people. And then the second part of that, of these mechanisms, are neurotransmitters that are produced even more when we focus on serving other people. So, for example, endorphins, dopamine, serotonin, and oxytocin. And these are another part of the reason why it feels good to help people and can give us some benefits. Third, serving others and being other focused shifts the nervous system. It tips the nervous system towards activation of the parasympathetic nervous system. So the chill, relax part of the nervous system, rather than the sympathetic nervous system, the fight or flight response. And so it tips our nervous system over towards that relaxing state. And many people know this experientially because it not only feels good to help people, but when they are doing it, it has a calming effect upon them. In the last two mechanisms, this is what we could call the dynamic or perhaps the deadly duo. It's stress and chronic systemic inflammation. So what research shows is that serving others not only reduces our stress in the moment and makes us feel less stressed, it actually buffers the association between chronic stress and increased mortality risk. So it actually reduces our mortality risk by buffering our stress response. Lastly, serving others can actually downregulate gene expression for chronic systemic inflammation. And so we know that chronic systemic inflammation, if sustained over long periods of time, is associated with all sorts of bad things like cardiovascular disease and cancer. So the last part of the mechanisms is that it downregulates this gene and perhaps can have an effect on chronic systemic inflammation. But what's important to recognize, and I just want to say loud and clear, I don't have any magical thinking, no magical thinking. So this isn't a one and done sort of effect. Like I served somebody once, so I'm going to be set into my 90s, right? That'd be like thinking I ate my vegetables once, so I'm going to have good health and longevity late in life. No, of course not. It has to be part of our daily routine. It has to be part of who we are, and sustained consistently over time.
So look, I can imagine people think, well, that's great. Like you focus on other people, you serve other people, you reorient yourself. So you're trying to find those 9 opportunities a day that they found at the University of Toronto that people miss to be empathetic towards other people. You're going to fill that with being able to do kind things and serve others. And that's great with these health benefits, but you're going to end up someone who isn't competitive in the world, in your professional life. You need to be an apex predator that, kills all your enemies in order to get ahead in success? Is there data, or I know there is, talk about the data or the concepts behind the fact that this also applies to your professional life and how you treat others?
Sure. So researchers have found this concept called idiosyncrasy credits. And what that means is when you are what we might call a live-to-giver, and somebody who is other-focused and giving rather than a taker, and somebody who is always looking to climb up the ladder no matter who they step on. If you are a live-to-giver, you will accumulate idiosyncrasy credits in your workplace and in your career. And what that means, what that term refers to, is that you'll be given the benefit of the doubt when you struggle or you experience failure, because people will want you to succeed and they will protect you perhaps when you do experience failure, as opposed to someone who is the apex predator. Those people have a target on their back consistently. And so what the research shows, in fact, I'm thinking right now of a study from Cal Berkeley's School of Business, in which they followed, they did personality inventory, and they measured in a rigorous, validated way what people were like in how they interacted with each other, and whether they were
disagreeable, I think was the term they used, right?
Right, versus a what they called a generous and agreeable extrovert. So basically, a giver versus a taker, right? And what they found over time, over 14 years of follow-up, is that the people who attain positions of power are the givers, not the takers. And so the notion that the question, do nice guys finish last? We want to be evidence-based throughout all of this work. And the answer, according to the evidence, is no. Nice guys don't finish last. In fact, the research supports that they are more likely to attain positions of power than their apex predator colleagues.
And it makes sense, right? Like, it's better to have the wind at your back than a target on it, which is essentially the difference we're talking about here.
That's right. I totally agree.
All right. So we talked about that there is a problem, what we think the cure is. We talked about some of the benefits of that cure. But what's the prescription for the steps people can take? Like, I think about, we won't have time to get to all 7 that we talk about, but I think of the first one as start small. Like, you can just do this with the people that are around you. You can do this with your interactions on everyday life, those 9 interactions to empathize every day that we miss. And starting small is, you don't have to move or quit your job. Whatever it is you do, you can start to focus and just find all those opportunities around you. So start small is the one I think of. What's one of the other prescriptions that you would want to bring up?
So you might have heard, and everyone in the audience might have heard, that an attitude of gratitude is good for you. And it is. There is really compelling evidence behind that. But why? I mean, why is it? And what researchers have found, and this is using meta-analytic techniques, so the studies of the studies, what the researchers have found is that being grateful and gratitude primes people to look for opportunities to help and serve others around them. So actually being grateful, that state of being grateful, drives us to being a better live to giver. And we've already curated and synthesized all the evidence that being other focused and serving others is the best medicine for yourself. So now we have a mechanism why being grateful and having gratitude can actually be good for you and associated with all those benefits.
So I will tell you, I think it's important that we talk about elevation, because a lot of us are in institutions where we're interacting with learners, and even if you're not, even if it's just your colleagues or those on teams you work with, this concept of elevation, which is essentially a positive emotion. It's in this list of emotions separate from other emotions. We think about it, with respect to things like admiration, and you mentioned gratitude. But I love talking about this concept of elevation. Can you give us a little more detail to it?
Sure. So much of this research has been done by renowned social scientist Jonathan Haidt, and elevation is defined as an emotional state of uplift that comes from bearing witness to others' moral excellence, heroism, going the extra mile for someone else. And when we have that line of sight and see the goodness of other people, and you may know this experientially, that perhaps you have that feeling in your chest when you see your colleagues or anyone really doing those things for other people. It is a state of emotional uplift, and it's now being rigorously studied. And what the research is showing is that when we are in a state of elevation, in contrast to being degraded, because let's face it, people can either elevate us up or they can drag us down. We all know toxic people that might drag us down. What the research shows is that our behavior will follow. When we experience elevation, we are actually primed to want to be better ourselves. And that's not just wishful thinking or opinion. There's research that supports that we do better, we serve others better, we look for those opportunities when we feel elevated. But when we are around people who degrade us, we actually do all of those things less. And I want to just add, Maz, that there was nothing good from the pandemic. And I need to say that out of respect for all the people that we lost. But there are things that happened in the pandemic that I will never forget. And I think that I'm better for it. And specifically, I'm thinking about elevation and our nurses and our colleagues, our technicians, our respiratory therapists, our trainees, and in our communities, like neighbors helping neighbors, and perhaps they didn't even know each other, but now they're going to the grocery store for their elderly neighbor who needs help. That elevation is what I will carry with me, among many other things, of course, now as we hopefully have this pandemic in the rearview mirror. And elevation is powerful. Elevation is powerful. And the message for any trainees that might be attending the conference is that you want to be very careful who you associate with. And when you go out into the world and get your next job, like, are you going to be with people who raise you up or tear you down? And we've all known from, perhaps antiquity that those things are true or important. And the science now shows quite clearly that it does affect us, not just in meaningful ways, but actually in measurable ways.
Yeah, I have to. One of my favorite studies is the one out of UCLA, where I think it's a great one to explain to people, where they had people watch through, different groups watching different videos. And one group watched a video called Unsung Hero. It's gotten 120 million views or so on YouTube, and it is a Thai insurance commercial. But Unsung Hero is this video where a gentleman is feeding a dog and watering a plant and helping a young child and helping an older woman, and sort of over the course of time, ultimately he's serving all these people, and it has a fantastic ending. And I encourage everyone to go watch it. So one group gets that video, another group gets a video about parkour. Parkour is where people jump in between buildings and do all that kind of stuff. And then a third group had the video just watching crowded people on a subway. And then as they were leaving, not knowing this was part of the experiment, they gave each person $5 for participating. And they said, oh, here's the UCLA Children's Hospital, bucket, go ahead and put money in this envelope if you want to. And we appreciate if you want to, give your $5 or some of your $5 to that. And then they went, and what do you think they found? Well, people were elevated by the video Unsung Hero, and it was the group that watched the video Unsung Hero that gave more money. But that's not my favorite part of the study. The best part of the study is, it turns out the researchers who were putting this together thought they made a mistake and thought there was a problem. Because what they found was that the people that watched Unsung Hero, they were getting back more than they gave out in money. People were giving more than $5 in the envelope. They were dipping into their own pockets. That was the power of how much they were elevated from seeing someone else focus and serving others. And to me, that's tremendous. So I want to end with asking you, Steve, what's one of your favorite studies that would emphasize any of the points or even points we hadn't made yet that you would want to tell people about?
Well, what research shows quite clearly, and so rather than one study, I'm going to talk about a concept that shines through in many studies.
If I was an interviewer that wasn't your co-author, I would say that, answer the question. I would pin you down like a reporter, but go ahead. However you want to handle it, go ahead.
As this is a resuscitation conference, right?
Fair.
We have to, there's one principle that comes through loud and clear. There is something about healthcare experiences that stay with people. And I don't just mean for weeks or months, but perhaps forever, where literally they will never forget it. And I don't know if it's because the amygdala, where we experience intense emotions, is in some proximity to the hippocampus where we make our memories. But what the research supports is that healthcare experiences stay with people, probably because the intensity of the emotion that is associated. What the research shows is that 5 years from now, when if you take care of patients today who perhaps present with a life-threatening medical emergency, 5 years from now, they won't remember the technical aspects of the care. They won't remember the surgery they had and the technical elements of that. They won't remember what medications were running through the IV. They won't remember any of that, but they will remember how they were made to feel in the moment, which might remind you of a Maya Angelou quote from her work, where people don't remember what you say or what you did, but how you made them feel. There is robust evidence to support that. Robust evidence. And I think it's important for all of us, and especially trainees, to ask themselves a question when someone comes in and they're in their most vulnerable moment, perhaps, of their life, and they're terrified. Research shows they're going to remember this 5 years from now, and how you made them feel in that moment, and what do you want to be remembered for. And if we don't consider what people remember 5 years later to be an important outcome measure, I think we need to recalibrate on that.
And I can echo that. It echoes. It echoes with you, and you remember that over and over again. Well, thank you, Dr. Trzeciak. Thank you, Haney, for giving us the opportunity to speak with you, and I hope you enjoy the rest of the conference.